Right, so for those of you that don't have a foam roller or don't want to use a foam roller, we're now going to use a tennis ball and a towel to help us get some relief from some of our aches and pains. So we'll start with the tennis ball, one that I give to lots of people, just putting it underneath your foot. You can do this whether you're sitting on a chair, sitting on the sofa, roll it around, get right underneath the whole foot. Any bits that feel a bit stiff and a bit tender, work into those. Get right underneath the toes as well. Might find a few crunchy bits in there, which is completely normal. Just roll it around, get right underneath the heel as well. I quite often tell my patients to take a tennis ball when they're travelling. Really easy to put in your hand luggage. You can roll it around underneath your feet, keep your feet and your ankles moving, which helps reduce the risk of DVTs and reduces the swelling, general swelling that you can get in your ankles. And also when you get to wherever you're going to, you've got a tennis ball you can play with as well. So let's do the other foot. I quite often sit there in the evening when I'm watching TV and just do this, because it's just really easy to do and you don't really have to concentrate too much on it. Get right into the arch of the foot as well. And just see which foot is a little bit tighter than the other. Okay, we'll do our calf muscles. So the good thing with a tennis ball is any real stiff parts that you find. So I've got one that's a little bit uncomfortable there. So I'm just going to keep the pressure on that spot and just point and flex my foot. And let's move on to the next part. So uncomfortable, but not really painful. And you might get some bits, like I've got one there that's just a bit clunky. It's not painful at all, but there's obviously some bit of fibrosis in there. We'll do it on the other side. You can kind of put as much pressure down as you want to, but just try and keep the ball moving. Okay, you can get into your hamstrings as well. Not quite so easy, and sometimes it's actually easy just to use your hands to do a bit of self-massage in there. In a bit, I'll show you this sitting as well. It's actually slightly better when you can get a little bit of weight onto your hands or onto the tennis ball. So tennis balls are really good for releasing off the glute buttock muscles. So what you would do, just lay down at the tennis ball. So if you find your hip bone and your sitting bone, you're going to put it right in the middle there. So bent knee and let the leg drop out to the side. This one generally is quite painful. And what you're just going to do is just hold it. If you want to, if you're finding it particularly sore, you can put some cushions or something underneath the knee just to support that. But what you should find is that gradually the muscle gives in and starts to relax, and the leg is able to drop out a little bit further. So if you've had any treatment from anybody, you might find this is the spot that they use their elbow on, because these are pretty strong muscles and they get really quite tight. And particularly if you're sitting a lot at the moment, they're actually going to get weak and tight and uncomfortable. So you can move the ball around a little bit, move it a little bit higher up. So we're making sure the ball gets into the fleshy parts and not actually onto the bone. Most people find they hold quite a lot of tension in the glute muscles. Even at the best of times, at the moment, when everyone's generally a little bit stressed, they're probably holding a bit more tension than normal, and it's all going to be going to your shoulders, calf muscles, glutes. They're going to be holding a little bit as well. Right, let's do the other side. And just see which side of yours is tighter. So whilst you're doing this, just try and let the legs really relax. Try not to hold them tense. Try and let yourself relax into the movement. And for me, this side is not giving in as quickly as the other side. It's being a little bit stubborn, but that's fine. Okay. So if you have 2 tennis balls, you can be particularly adventurous, put 2 of them into a sock and you can roll them up and down your back. If you haven't got 2 tennis balls and you've only got 1, you can just use the tennis ball, roll up and down on one side of your back and then change it across to the other. And again, the tennis balls are really good size, just to get into some of those knots. People do ask me if they can use a cricket ball or a golf ball, and some people do. Personally, I think they're a bit hard. The good thing about a tennis ball is it's got a bit of squish in it, but it's hard enough. The other thing that could be quite useful is a squash ball, because they've got a bit of give in them as well. But anything that's really, really hard probably isn't going to do you a lot of good. And you're probably going to end up with a few bruises as well. So tennis balls are particularly good for around the shoulder blade. So you're going to lay on the tennis ball just inside your shoulder blade. You can do this against the wall as well. And I'll move the camera in a minute and show you that. And what you can do is just move the arm around or have a wiggle up and down or side to side. So the wiggling is easier if you're standing up. And you can get that tennis ball into just at the back of the armpit. And get into some of those rotator cuff muscles. And again, so you can move the arm around. Now I should say, if you have a dog, they might think this is a really fun game and we're jumping all over you at the moment, so you might want to do this in a room without the dog in. No, most people that have a dog have a tennis ball. So I'm just going to do that. I'm just going to move the camera. Just do this against the wall. So I'm just rolling myself up and down inside my shoulder blade, and I'm rolling it out to the side. Lots of clicks and clunks coming out of my shoulder there. Okay, I'm just going to do the other side. get into the back of the shoulder blade. So you need to keep a little bit of pressure on the ball just to stop it from dropping. If you put too much pressure on balls, we're going to ping off in a different direction. And again, really good to work those rotator cuff muscles, the little tiny muscles around the shoulder that attach onto our shoulder blade. Our desk postures at the moment are not conducive to good rotator cuff function and good shoulder function. So really good to loosen those off. And then you can get the tennis ball into your pectoral muscle as well. And just the other side. Okay, then we're going to work into our neck. And we'll start off doing this against the wall as well. So we're just going to put a little bit of pressure. Just get it right at that point, just where you're basically on your hairline, so where your neck and head are meeting each other. And then whilst you're putting a little bit of pressure on the ball, just nod your head, tuck your chin in. Give yourself a little bit of massage and turn your head slightly to the side. And do the same. And get a bit further to the side. So you're just behind your ear. So we're keeping a little bit of tension on there. Then go right into the centre of the neck. And this one I'm just going to tuck the chin, so give yourself a double chin. And you can get a little bit lower down as well. Just take your head side to side. So we're not pressing too hard in here. A little bit lower down. We'll just do the other side as well. It's not the easiest of things to demonstrate on a video, so I hope you're getting the idea. And again, you'll probably find that one side is harder to do than the other, or more uncomfortable to do than the other. So I'll just show you how to do that on the ground, so I'm just going to adjust the camera again. Sorry, my computer screen keeps on going off as well, so I'll keep on readjusting that too. Let's just unzip this. So if you're doing it laying down, there's a lot more pressure on the ball, so you just need to be quite careful. You don't want to go too hard. If you're going too hard, you'll probably find that you give yourself a headache. And actually the aim of reducing the tension in these muscles is actually to reduce the likelihood of having a headache rather than increase it. So you might find a few spots when you're doing this, so nodding and side to side, will actually send symptoms or almost like an ache elsewhere. So I have a couple of spots that if I get onto them, they send a pain to my temple, into my jaw or into my forehead. And the top of the neck is a very common area if you get headaches for referrals. So the neck can refer pain to the rest of the head. So there's tension headaches that you get. Quite often there's a lot of tension in the top of the neck. Now another way that you can release off your neck muscles is using a towel. So this is actually quite a big towel. So I'm just going to make it into a long band. And you're just going to get that behind the back of the head. And just a little bit of gentle pressure. Take the head forward and just let the hands pull the tail down slightly. And give it side to side. And then push the head, so the back of the head into the tail. So we're putting the hands forward, but we're trying to push the head backwards. So we're lengthening the back of the neck. Then you can get the towel right onto the neck. Take the head one way. You can just use the towel to do a little bit of massage. And you could, if you wanted to, put the tennis ball into the towel. I haven't actually tried this before, but we'll give it a bash. That works quite well. So the same could probably go just putting that pair of rolled up socks in there as well. So putting pressure on the towel, and then you could take that onto your back as well. But you're drying yourself in the shower. You can set to massage any part of the body. So the other thing we can do with the towel is we're going to roll it up. So I'm going to roll it this way. And we're going to put it underneath our back. So right in the middle of your back. For ladies, that's kind of bra strap area. Take your head back. I haven't got much room here. Okay, so we're going to take a nice deep breath in. And as we breathe out, take our arms back over our head. Just a bit of mobilisation for that middle part of the back. And we'll come back and we'll go again. And once more. And you can put the towel lengthways along the spine and just relax back. You might want to put a cushion behind your head if you're doing this, just to support the neck if your neck doesn't like extension. And again, just take some nice deep breaths in. Okay, and the last thing you can do is try and give yourself a little bit of traction. So we're just going to line this towel up again, as it was before. So this time I want to get this right at the base of the skull. So as you're pushing your head back into the towel, you're just trying to lift up with the hands. So we're giving it a little bit of a lift up. At the same time we're just tucking the chin and pushing the head back into the towel. So we're having a little bit of traction effect and lengthening the spine. And hope it just takes the pressure off of some of those joints. So I hope you found that useful. I'll come back over the next few weeks with some other things that you can do, some assisted stretching, using a towel and bands and stuff. And hopefully we'll keep you moving over these coming few more weeks of lockdown. Right, take care everybody. Bye. Okay, so the other thing that I need to show you is hamstring release that we couldn't do on the floor. So what we're going to do is get our tennis ball and just place it underneath. So ideally you want to be sitting somewhere where your foot isn't touching the ground. And what we're going to do is just get the tennis ball into a fleshy part of the muscle, anything that feels a bit sore. And all we're going to do is just swing the leg, swing the foot in a circle, and you can straighten the leg out and back. You can use your hands to do this as well, but a tennis ball saves a lot of strain on your hands. And just find any bits that are a bit sore. And my hamstrings are quite sore today. And work your way up the hamstring. Oh, that's a really sore spot. I definitely need to eat a little bit more of this today. And then get right the way up. Right up onto your sitting bones, or just in front of them. And again, just get a little bit of a swing going with the foot, swing it in a nice big circle. And make sure you don't forget the inside of the hamstrings as well. They can be just as horrible as the outside of them. And I've got a really good knot right in the centre of my hamstring there, which doesn't surprise me. So I will do the other leg shortly as well. But the other thing I should have said to you was, once you've done some of this self-massage and self-release, using whether it be the foam roller or the tennis ball, do make sure you rehydrate afterwards, have lots of fluids. It doesn't have to be just water, but just make sure you rehydrate your tissues exactly the same as if you've had treatment with somebody or they've done massage. It's a little bit like exercising, so you might feel a bit sore afterwards as well, but it's a really good idea just to rehydrate too. So good luck, and if you have any problems doing any of these, or anything that you can't seem to get rid of by doing a little bit of self-treatment and some stretching at home, then please do get in touch with us at the Retreatery. Take care guys, bye!